Welcome back to the Fitness for Back Pain podcast. This is episode 3. I'm super excited to be talking with Dr. Charlie Johnson. He's a doctor of physical therapy and is a residency trained with a board specialty in orthopedics from the University of Southern California. This places his knowledge and experience among the top 1% of PTs in the world. He authored and published a book early in his career called The Itty Bitty Book About Lower Back Pain, which can be found on Amazon, or he's happy to send you a copy. Just ask him. He's a creator of the Glute Relief Accelerator program, where he teaches people internationally with unresolved back, butt, and sciatica pain how to heal themselves naturally using the power of the mind and movement as medicine. He lives in southeastern PA with his high school sweetheart, Heather, PT coach by day, and tickle monster to his 5-year-old daughter by night. That's awesome. I'm a family man myself, so that's always like really cool.
Cool,
The
man.
dad
How many
bod
kids do you
holding it
have?
down. I've got 2. I've got a 10-year-old daughter and then a 7-year-old son.
Neat, man. Good
Yes.
stuff.
So it's excited. But again, I really appreciate you just coming on the podcast. I've been watching your content for a very long time. It's some of the best content when it comes to just all things back pain and the mind-body connection. And it's really, you take an approach that people, they don't think that they need it, or they don't really know or understand the mind-body connection and what is pain science, and just kind of give me stretches, give me exercise that I can do. And you are just so consistent with saying, hey, that is an element of it, but there's so much more to it. So just want to encourage you, man, keep doing it. It's life-changing. It's not the most sexiest stuff that you can put out, but it's the most powerful stuff. So kudos to you, man.
Cool.
So
Appreciate that,
today,
man.
yeah, man, absolutely. Oh, I almost ripped my mic out of my thing. Today, we're going to talk about, there's a few different things. The main topic that I want to talk about is Piriformis Syndrome. And the title of this episode is Piriformis Syndrome: What is it and how to beat it without making it worse in the process. So this can be a very deep conversation, or very kind of just easy, actionable type of topic conversation we're going to have. And I want to hopefully keep it really simple, but also very practical for people. So we're going to dive into that topic. First question, though, before we jump in, what made you land where you are today? What got you into helping people with butt, back, and sciatica pain?
Yeah, man. Totally. So background story, right? You already know a little bit of it, but for any listeners, right? So in high school, man, I started dissecting frogs. I took an anatomy course, right? It's a true story, right? Can't make this up. You know, on those soapstone countertops in anatomy class, chemistry, right? Like that was our lab. And so just fascinated, man, by anatomy. Grew up playing ice hockey my whole life. So it was like super athletic, like one sport focus, like non-stop 24/7, lifted weights and just nutrition. Just, I don't know, interested in living a healthy life, man, and being active. So that took me to kind of pursue, hey, what are some careers that I can do that are sort of maybe involved with athletics, but then also kind of combine this passion for anatomy and whatnot. And naturally just was like, hey, PT sounds like a good option, right? Plus I had some weird family stuff. So I was like, let me get out of this place, right? And so I went to college, right? And I wanted more of like a university level type of experience there. So yeah, man, went to PT school, graduated with my doctorate from Lebanon Valley College. Then afterwards went out into, the real world, man. And just like started practicing PT. Very cookie cutter stuff is what I found, right? And so knowing that I wanted to help people, tried to go into just a traditional outpatient orthopedic practice because I was interested in this back and sciatic. And it was more like the athletic path, right? You see more athletes out in that setting versus in hospital and whatnot.
Yeah.
And then, man, just realized that like people were doing the same exercises for everybody, regardless of what actually was going on with them, right? And it was just like, if it didn't work, it didn't work. And if it did work, it did, great. And so, yeah, man, it was, I thought there's got to be a better way than just like slinging hot packs and like TENS units on people, sitting them in a chair while they read a newspaper, and then like we're gonna give them some bird dogs,
Or that hot wax stuff. I remember when I was at my dad's a PTA, and we used to go to his clinic, and he used to let us put our hands in that. Is it paraffin wax?
Paraffin
They don't
wax, you
even
got
use
it.
it anymore. I don't even know if they use it anymore. But man, we used to love that
Well,
as
now that you
kids.
said it, it's going to come back. We're going to be dipping people's like butts and backs in it and stuff like that, and creating some cool molds. Anyway, yeah, man. And just like, I've always been somebody who wanted to do the best I could at what whatever it was, man, whether it was sports, whether it was school, like that type A, high achiever personality. We'll get to that later. Right.
Yeah.
And so I got a little bit fed up, right, with just like high volume of patients and things like that. And just kind of like feeling like I didn't really know the answer, but I knew there had to be something different. Right. And so then I said, hey, like, who's writing the books? Who's the best of the best? Like, where are the gurus, right? As it relates to pain and movement and function and rehab and, stuff like that. And so I applied to residencies. I got accepted at USC, University of Southern California. A lot of my mentors are out there. A lot of people kind of like update the research. Just a lot of progressive stuff happening out there versus in my town of Schwanksville, Pennsylvania, here in PA. There's not much going on.
It doesn't sound like it.
Yeah, sorry, man. Not much going on. So I moved out there, man, and got to study like with all these really well-known people. So studied under like the Mackenzies, the McGills, the I don't know, like all kinds of different people on the movement side of things, hip spine surgeons, radiologists, pain management docs, just like all kinds of pretty much any different approach or any approach that's out there. I studied some form of it. Osteopathic, was trained by osteopaths, chiropractic, acupuncture, dry needling, massage. I'm not any of those things, right, by degree, but I got touches and got to work right next to all these folks. And so sort of what landed me here, man, with even the creation of like my program and sort of my niche or my focus is that I worked with hip and spine surgeons at USC. And so I just saw a ton of people, man, with these different problems. And nobody really knew what the heck was going on, including me. And so let me study from all these people and let me see what I can pull from each of them. And then a turning point for me, man, was two things. All right. One thing is that you have like these clinical mentors. God, I have to even think what's the name of these. Like we had these experiences where mentors would come in, okay? And they would watch you treat a certain patient, all right? Now you were supposed to change patients, right? Because you want to get a diverse experience and like, with somebody who has shoulder pain, somebody who has back pain, somebody who has knee pain. I didn't care about that at all. I said, you know what? I just want to learn everything about this back and hip and butt thing because it's so complicated. And in PT school, I forgot to mention, like I was a teaching assistant for gross anatomy, cadaver lab. So got to dissect cadavers, right? Yep. People donated their body to science. And again, it was just like the most complicated area, So I was like, I just need to master this. I need to figure this out. And back pain, like #1 cause of disability in the world, right? Pretty big issue. Mm-hmm. Here's a major problem that nobody knows how to solve. Cool. And it's fascinating. And so what I did is I took one person with like this back kind of butt kind of leg stuff. And I took 6 or 7 different mentors, right? So it was like one person, 6 or 7 different people. So I was sitting there working with this person and this mentor who was a diplomat of Mackenzie, the highest trained Mackenzie practitioner there is, right? Was like, hey, it's this, it's that. Like, why are you doing this? Why are you doing this? Hey, we're going to end up doing X, Y, and Z, right? And so I went down one path with them, right? I think it was some type of like, I don't know, press ups. Right, or something like that. Mm-hmm. All right. But either way, like they showed me their model and I was like, okay, that makes sense. Right. Studied everything about that. Then what I did is I took that same person, with back, butt, leg stuff. And I said, I'm not going to tell anybody about this, but I'm going to pull another mentor. And this person, McGill Master. McGill Master. And here's what they said. Why are you doing that? You should be doing this. This is getting interesting. Right. And then I was like, right. And so then I'm looking at different, like, I don't know, stability patterns and, like different things like that. Talking a lot about pain triggers and all kinds of different stuff, movement tools and re-education of stuff and abdominal bracing or whatever. Right. So I'm doing all that. Then I take that same person like 2 weeks later and I bring in Shirley Sarman. All right. She's like very much into movement impairment syndromes. Right. Mm-hmm. So I don't know if you know much about her, but like, okay, so the hip flexors are doing this and there's relative stiffness of that. So you need to do this and just like a little bit of a different approach. But she said, why are you doing that? And then another person who is very much hands-on or manual therapy from the military, very manual therapy or pro-manual therapy in kind of the military world in most cases. And so then it was just kind of like move it and move on. I was doing manipulation or grade 5 mobilization. And they all said, why are you doing that? I thought this is really interesting. We have all these gurus who are like really good. I mean, all their textbooks are on my bookcase here.
Yeah.
You know what I mean? But nobody could agree. So I thought that was weird. Nobody can agree. So I said, is it that they don't agree? Or are they all trying to say the same thing if we can boil it down? Right? They all look different, the approaches, but is there something at the root of all of this, a principle that's driving everything? And that's what I continue to aim to find. And then one other experience is that I was at sort of this roundtable discussion where I sat with a spine surgeon, hip surgeon, more of an osteopathic type of physician, somebody who performed like myofascial release, very hands-on in that world, Pilates and yoga instructor, myself, and then like one other person. And we were reviewing this case. And we were to basically give our opinions and our thoughts about the treatment for this person, the best kind of method of management, right? And it was like, man, if the only tool you have is a hammer, everything's a nail. So the surgeon was like, oh, I think we could do this. And then the chiropractor, the osteopath was like, oh, I think, they've got some type of rotation in their hip, right? And so we're yanking on legs and we're doing this or we're doing that, right? The massage therapist was like, no, it's a trigger point, right? And I was just like, by the time it got to me, I almost didn't know what to say because I realized that it probably didn't have much truth or validity given the fact that nobody really knew what the heck was going on.
Yeah.
Right. And so I had these instances, man, where I was like, there's got to be something deeper. It's like we're all hitting these superficial points, but is there one thing that can all boil down to such that we could actually teach people and come up with some type of approach that, I don't know, is in some form of agreement and or really something too that we can pass on to the patient, right? Because we talk at such a high level in medicine, but it's like if the patient doesn't get it, they don't care about our method per se, right? They just want to feel better, right? And so long-winded way of saying that's how I landed where I am. I basically then synthesize. I'm a synthesizer. I don't have a method per se, right? I look at everything I've learned, all the different approaches. I've synthesized everything and tried to boil it down to just the bones, right? And then I deliver that to people. And that's the goal.
That's awesome. Yeah, I mean, and that's the thing about it. It's like the medical model and just being around these high level thinkers, doctors, people, surgeons, they operate on a level that's just way up there. So to be able to take your experience, that knowledge, being on that level, and then coming down to, let's say, a 3rd grade reading level, not that we're dumb, but you can make it so simple and so actionable. It kind of makes it less complicated and kind of empowers us as back pain sufferers or sciatica sufferers to be like, like maybe I could do this by myself. Maybe the doctors are great people and they're saving lives and doing all this crazy cool stuff. But when it comes to back pain, I think I have more control than I thought I did. And I think that's really cool. Now, with kind of shifting over to just this topic of piriformis sciatica, I mean, I'm sure you have, answered thousands of questions on this topic. It's pretty popular and just something that needs to, I feel like it's been explained, but I think you'd be the best person to answer these questions. So what would you say is the difference between true sciatica and piriformis syndrome?
I would try to make this as simple as possible, but here's the thing. Well, you can make this simple or you can make it really complicated. All right. So let me talk through it, right? And then we'll boil it down. All right.
All right.
So what I'd say is this, like, I think first, in order to answer that question, we've got to define like true sciatica. All right. And so versus like what people really like think sciatica is. So lots of people, they see me, they're like, hey man, I have pain in the leg. I've got sciatica, right? This is like, you go to a Christmas party and everybody has sciatica because they have leg pain. It's actually not very common. Okay. Sciatica is simply, right? Like sciatica is a symptom, man. It's not necessarily like a diagnosis. Lots of things can cause sciatica. All right. So sciatica is basically, I don't know, Symptoms, right, caused by irritation of sciatic nerve. There's multiple branches of sciatic nerve, starts like a wire, goes down the back of the leg all the way to the foot, okay? Generally, and here's the difference, all right? True sciatica, man, is like irritation problem with nerve. There's two types of pain. You can have nerve pain or you can have referred pain. Just make it really simple, okay? Meaning, nerve pain, sciatica, generally very, very painful. Cut my leg off type pain, all right? Usually pain below the level of the knee into the foot and follows generally a very like kind of narrow band. Electric, zapping, nerve-like symptoms, numbness, tingling, very narrow band. It follows what we call dermatomes. Basically, there are certain mappings, man, within the body related to certain nerve levels, sort of real estate on the skin, if you will. Nerve supply information such as feeling and movement, just generally, all right? And so if you have a problem with the L5 nerve, right, and that's irritated, sciatic, that branch of the sciatic nerve, then you're going to have symptoms in a very kind of pattern distribution. There's a little bit of overlap, but there's a certain area of the skin where you're going to feel it, all right? And again, usually pain below the level of the knee in a very narrow band, numbness, tingling, things like that. And there are other signs associated with it. Clinical tests, for example. Straight leg raise tests, without getting too far into it. If you're sitting there and you kick your leg up and out, right? And you can do that, chances are not good, okay, that you have sciatica. Meaning like that test is so good, it's such a sensitive test, meaning it's a really good screening test. If you do a straight leg raise test, it's shown on Google and everywhere else as like somebody having to raise your leg, but call it whatever you want. I'm not sure how it affects the validity of it, but I mean, if you can kick your leg up in the air like you're kicking a soccer ball, right, and you say you've got sciatica, probably not. All right. It's like 95% good at detecting sciatica. It's a really good screening test, a straight leg raise test. All right.
Okay.
So narrow band, usually pain below the level of the knee into foot, right? True sciatica, symptoms caused by irritation of the sciatic nerve or any of the branches. And here's the thing, anywhere along the path, tricky, right? Now you can have, so that's nerve pain, or you can have referred pain. This is what people think is sciatica, but it's not. This is majority of cases. I have pain in my butt and in the back of my leg, and it kind of stops around the back of my knee. It's achy. It's general. It's hard to localize. It kind of just moves around, and it's like it's deep in there, and you know, it hurts, but it's not going below the level of the knee. They don't have a positive straight leg raise. They can kick their leg up, right? And this can be caused by lots of things, man. You can inject a disc in the spine, L5 disc, let's just say, right? And you'll feel pain in the butt and then back of the leg, maybe below into the calf, but it's not as common, right? That's referred pain. So a structure not involving the nerve, you could aggravate in the spine. They can send symptoms, referred symptoms, not nerve symptoms, right, into the leg. You can irritate a joint in the back or in the neck, right, or anywhere, right? And it can send symptoms not only where you irritate it, but then also into the butt, in the leg. And so you have kind of this nerve pain, true sciatica, indicative of that narrow band, electric shooting, below the level of the knee, legs on fire, cut it off. Or you have like this, I don't know what you want to call it. Some people say pseudo sciatica, fake sciatica. It's not sciatica at all. It's just referred pain. All right. Okay. And so that's sciatica. It's a symptom. Now, like I said, there are many things that can cause it. Versus piriformis syndrome is kind of this diagnosis, this label, right? This cause. All right. So let's get deeper into this, right? So sciatica can be caused by a disc problem, most common cause, all right, at the level of the spine. It could be caused maybe by piriformis syndrome. Piriformis could irritate the nerve. Remember, the sciatic nerve is just a wire, the whole thing, right? It could be caused by lots of stuff. It could be caused by some space-occupying lesion in the butt cheek that we don't even know is there. It could be caused by some benign little tumor somewhere, right? There's lots of things. That's not to scare the viewers. It's very rare, by the way. Okay, but is that many things could cause your sciatic nerve to get irritated, right? Piriformis syndrome, man, I think it's thrown around a lot more than it actually probably exists because, and by the way, like probably the more like widely accepted term nowadays is like this deep gluteal syndrome.
Mm.
And I would tend to agree more with that. You know what, you can always edit this out if you want. But I worked with this will go back to the point. I worked with a really well-known shoulder surgeon. And he said, and we did all this research or whatever related to rotator cuff pain when I was on the West Coast, right? And he said, you know what we know about diagnostics and shoulder pain? He said, shits. It's something hurts in the shoulder, right? And so we spend a lot of time trying to like, dude, if we do this and we do this, and I'll talk through it, man, because I know the theory,
Yeah.
right? But at the end of the day, it's like deep gluteal syndrome. Piriformis syndrome kind of refers to this idea of like, you've got a problem just with this muscle and that's it, right? Like, but how is it that all the other muscles can't get irritated too?
Mm.
We don't see like a Gemelli syndrome, obturator internus syndrome. I mean, I don't really hear of those things. I'm sure somebody's come up with it, right? But like when you get deep in the buttock and you fillet the butt muscle open, because I've done it many times, right? There's a lot of stuff going on down there.
Oh, yeah.
So I guess you would define, right? And I think it's been defined multiple ways, but piriformis syndrome is like, you know, a spasm, an issue, we'll just call it, with piriformis muscle that tends to aggravate or potentially could aggravate sciatic nerve. So again, it could be a cause of sciatica, which is a symptom, but it's really trying to get more like the diagnostics of or the cause of, right, why you have sciatica or not.
Mm.
Piriform is just one muscle. There's a ton of different rotator muscles deep in the butt. But for some reason, it caught on, man.
Mm. I mean, why do you think? So you're saying that like the piriformis, or let's call it piriformis syndrome, whatever.
Sure.
It can be from a lot of different things. So why is it that the piriformis acts up? If it's not sciatica, what medically can we make sense of when it comes to like, oh yeah, you don't have sciatica, but you've got what we call deep glute, whatever, you know, or piriformis syndrome. And this is why. Is there a why behind that? Or is it like, we really can't say why, this is just what it is? Like, how would you help someone understand that they don't have sciatica, they've got piriformis, and this is what you did to get there?
Yeah, man. So this is part of what I go into, like my diagnostic guide. I have a DIY diagnostic guide that I kind of share my algorithm, if you will, for solving this. But I think high level, man, I would say piriformis syndrome is more a diagnosis of exclusion. Okay, kind of like fibromyalgia is diagnosis of exclusion. It doesn't mean it doesn't maybe exist, right? It's just that, well, because it's not A, B, C, and D, it must be F, right? And so what you do, right, is you get to the diagnosis of potentially piriformis syndrome, talk more about that, right? This problem, right, that doesn't match with other things by ruling things out. Lots of people think it's valuable to rule things in. There's way more value in ruling things out. There's way more value in finding what doesn't work often than what does work, because it leads you to the solution. Right? That ticks a lot of people off though, right? Like, this isn't working. It's just data. And if we were unemotional about it, right, we'd be able to step back and say, this didn't work. This means that, but we can't do it. Many people have a hard time doing it. So when it comes to diagnostics, man, we want to think about the way that sort of pain works. All right. And we want to start upstream. Pain refers downstream. When you look at structural causes of pain, pain refers downstream, meaning that little disc model you have in the back, right? Like the discs in the spine are higher than the piriformis anatomically. Your piriformis is deep in the butt somewhere, in the middle of the butt cheek, right? So you've got discs, joints, you've got SI joint. It's another little tricky one in there, right, that people talk about, right? And then you've got below it, or kind of around it, you've got hip. And so the diagnostic tests that we have for piriformis syndrome, I would say, are not of really strong clinical value and or utility. They haven't been very well validated. There was a study done in 2002, Fishman et al. There was, I think, Martin, I don't know, I used to know all this research stuff. 2013, he did a research study that looked at another test, and they found like 2 tests that they would use right, to try to diagnose this thing. But more importantly, it's like, what is it not? And then if you have the presence of these couple tests, then we can say it is or it isn't, right? So you first rule out the back. A very simple way to rule out a structure in the back. Notice I'm not saying disc yet. I'm not saying joint yet. I'm not saying anything because there's a million freaking things in the back. Maybe not a million, but there's a lot. All right. And so just take yourself through an active movement test. If you're worried about the piriformis being on stretch, whatever, you can do some funky things to take it off. But the idea is like, hey, if you stand and you bend straight back, and then you twist one way and you bend back, and you twist the other way, and you could argue you're maybe moving piriformis a little bit, but not that much. And then you kink to the right and you kink to the left, and then I don't want to stretch the nerve because piriformis, whatever. Sit your butt cheek on a chair, hang the butt cheek off. That's painful. So you kind of remove the compression and any of the tension on that. Then flex forward, straight, flex forward, front to the left, flex forward, front to the right. All I went through was a clock. I went 12 o'clock was forward. I went forward to the right, 2 o'clock. I went, I don't know, 10 o'clock. I went 3 o'clock. I went 9 o'clock. I went 6 o'clock. I went 5 o'clock and whatever the other time is. That's all I did. I just checked the times with my spine. And if you can move your spine and there's no restriction, there's no anything funky going on, it does not reproduce your pain in the butt, pretty much like you don't have a spine problem. I don't know almost anybody who has a spine problem that can move their spine completely freely and not have an issue. All right. And so you can say, probably not it. All right. Then, is it nerve? Piriformis, it could cause nerve stuff, is a muscle. All right. Is it a nerve? Well, that's pretty easy because we have a test that with 95% certainty, right, if negative, could rule out, meaning if you do a straight leg raise test and you have no problem, then you don't have sensitivity of your nervous system with pretty high certainty. Okay, now we ruled out back. We moved the back all different directions. You could do these motions at home. Very simple, right? I've done this leg raise, not nerve. Okay, well, how about hip? Now, this is where it gets funky because it's impossible to move the hip without and not move the piriformis. But you can kind of say, is the problem in the hip joint or outside of the hip joint? Lots of times hip joint problems get pinchy in the groin. So you'll have groin pain. You'll have kind of outer hip pain. You can also have butt pain though too. There are lots of people I treat, man, who are like, I have Piriformis Syndrome. You look at their hip and they have an osteoarthritic hip. I have case studies in my guide, for example, of like people being like, dude, can you help me? My piriformis is lit up. I'm like, no, man, you need a hip replacement. Right? And so the idea, big picture, man, is you can use active motion. If you understand the movement pain relationship and you can establish a clear motion movement pain relationship by moving your spine in different directions, by moving your hip in different directions, and by moving your nerve in different directions and trying to isolate these things and saying, not that, not that, not that. Okay. Then, okay, but we still have this pain in the butt. And or down the leg. What do we do about that? That's when we're like, okay, sound something deep gluteal, if structural, right? And that's where we may be able to use maybe a couple tests specific to Piriformis Syndrome to say maybe or maybe not. And then you could combine that with other diagnostics. Some type of local anesthetic block and or injection combined with a steroid to the piriformis via ultrasound guidance. I'm not so sure there's a whole lot of value or validity behind that.
Yeah.
Because when you inject something in the body, dude, as much as you say it's local, it still floods over to other areas. So for example, we've seen like, oh, you do these SI joint injections. Well, right in front of the SI joint is all the nerves. And so you inject it into the joint, but you also just poked a hole into the joint to get into there. Right? And so like what happens when you poke a hole in something? Stuff comes out. And so you shoot it in there, right? And like stuff kind of, you'll see some leakage of some of the steroid and the numbing agent. If you have a tooth and you're getting a fix, they're like, oh, I'm going to poke you right here. And they do. And then your whole face is numb. Is that not true? I mean, like the whole thing.
Yeah.
Don't eat ice cream. Don't eat ice cream. Why? Because this one area should just be numb, right? No, dude, you're not going to be able to feel your face.
Yeah.
Right? And so we inject things and we think, oh, that means this or that means that. But it's really hard to just isolate that and not have liquid go anywhere else. And so you're numbing just the whole area. You're just blasting it a bit. And you're saying, oh, this means that or this doesn't. I don't know about that. We could get really deep into that too. It's probably another topic, but I'm not so sure about that. So rule out back. If you're looking at structural causes, rule out back above, because we know that when we inject, for example, discs and joints and things like that, they refer pain down. They almost never refer pain further upstream. They refer downstream. Downstream problems usually have an upstream effect. A back problem can cause, with referred pain, the actual source of pain, can cause butt pain, can cause leg pain, can cause heel pain, can cause plantar fasciitis, can cause anything, toe pain. But a toe pain problem, the joint is aggravating the big toe. It's not going to refer pain up to the back.
Got it.
You could argue that you might be moving weird and this and that, but that kind of gets into some different stuff, compensation or whatever. But so that's where you start. Back, maybe SI joint, there's some stuff you can do there. Is it nerve? Is it not nerve? Okay. Is it hip? Is it in the hip joint? Is it outside the hip joint? Right. And then we're left with this problem deep in the butt. Now, is it piriformis or not? I'm not sure that we could actually tell with a lot of certainty. The only way would be maybe exploratory, remove it, see what happens. And some people are doing that.
Wow.
I wouldn't want to do it.
Yeah. Well, I mean, so let's say we've discovered through testing that it's not sciatica, that we definitely have that F option. Let's just, for right now, because we don't know what it is, we're going to tag it as Piriformis syndrome. Then we kind of get into like, okay, how do we treat this? And I know a common thing, and maybe this is too oversimplified, but in my mind, I'm like, there's three things we could do. We could just rest it. Don't keep making it mad. We can stretch it, or we can strengthen it. That might be oversimplified, but what would you say when it comes to, okay, I have this piriformis syndrome potentially. What should I do? Should I stretch it, strengthen it, or rest it? What is kind of like your synopsis of that?
Yeah. So pulling from all the people I worked with, all right, little nuggets from everybody, right? First step, less is always more, all right? So you've got to remove the trigger, pain trigger, if you want to call it that. You've got to remove the aggravating factor. If you've got a scab, you're constantly picking it, it ain't going to work, all right? Now, there's a catch-22 to this that I'll get into in a moment, okay? But the first thing you need to do, and this ties into your last question even a little bit, the first thing you need to do is you need to optimize things physically, not based off what someone else tells you to do or what's good or bad. You should sit like this. You shouldn't sleep like this. Sleeping on your belly's bad. You know, good posture, bad posture. Scrap it all. Find what feels yummy and yucky. That's how I've simplified it, man. I use yummy and yucky. I work with people all over the world, right? And it's like everybody, no matter what language they speak, pretty much knows what yucky is and pretty much knows what yummy is. All right. And so like you need to identify maybe your top, you can start with one, but maybe your top 2 to 3 pain triggers. Sleeping is the first thing that if that's yucky, man, you've got to try to optimize that. And there's ways to optimize it. Could be, I found 3 things. Nighttime routine, you're setting yourself up for failure when you sleep. It could be position when you're sleeping. I recommend changing position last because you're sort of unconscious, but not really. All right. So let's put it in order. Nighttime routine, you could change that. We could change surface, which would be mattress. Mattress is just a surface, right? And then you could change position, right? So sleep, if a pain trigger, if it exists as one of those top 3 pain triggers, we've got to optimize that. There's very clear research showing that if you do not sleep well, you're not going to heal very well, or you're going to hurt more if we get to the brain side of things. All right. And so you've got to optimize things physically in your environment such you're not continuing to aggravate the problem. Tricky thing is, man, is that this is kind of what I help people with, and probably like you too, right? You just don't know what you don't know. And so we're like, yeah, like I don't do anything that aggravates it. And it's like, that's weird because you're sitting there in pain right now, right? And your one leg is crossed over the other. Do you do that? How often do you do that? And then they uncross, say, oh, my leg, it feels better, right? Or they habitually sit in a certain way when they work because they were either told it was good or told it was bad, right? Or it's just habitual. Or they sleep in a certain way, or they sit on the same side of the couch every night. And because their TV's over there, they sit sideswept where they're on stretch in a yucky motion. So that's the other thing. There's 2 sides. First thing you got to do is you got to optimize the environment physically and mentally. Physically, identify your top 1, 2, 3 pain triggers, modify, tweak temporarily to not aggravate it. All right. here's the thing. Sometimes, a lot of times, man, people are doing things that they're told to do to solve the problem, and it's ticking it off. Just because someone told you to do it doesn't mean you should do it. That's the tricky thing. Oh, so like I am, man, I'm modifying how I'm sitting. I'm changing this. I'm watching. I'm being careful how I'm sleeping, bending. I think I found like how to optimize those things. But then because you have a belief that because you have a belief that which you've been told to do by some authority figure, dogma, told by someone else who believes that, they know everything, or you think they know everything, right? You should do these stretches. Here's a sheet of them. Yeah, well, right there, dude, I wouldn't be doing this. Right? How are you going to know what's aggravating it? You could be continuing to aggravate the problem by doing that which you've been told to do to try to fix it. Right? And so like I start off with calming muddy waters. It's like, dude, you've got to stop. You've got to stop everything. You've got to remove variables. We are in a scientific profession. Doctor of medicine. People say, I'm not a doctor, whatever. Doctor of PT, right? Doctor of chiro, whatever. Research-based professions. And yet we're doing like 20 interventions at once on a sheet of paper. I mean, it's like, so would you ever run a scientific experiment with like 20 different independent variables introduced at one time? Okay, 20 is a little exaggerated. 5, 6, 10. Probably not. And so how are you going to understand the findings of that study or the results? You can't. It's impossible. All you can say is that everything you threw in the pot worked, maybe. And if it didn't, you're screwed. And if it did, you don't know why. So you've got to calm muddy waters. The quickest way to calm muddy waters is to leave them alone. Alan Watts. All right. And so optimize things physically, right? By knowing what you know. I know that sleeping this way, I know that sitting this way seems to be a problem. Okay, great. And we've got to cut it out. All right. Then you've got to calm things down, remove variables. And then you've got to discover that which you don't know. How do I do that, dude? I don't know it. If you bring yourself through, I call this morphing motions. If you bring yourself through a basic movement exam, forward, okay, that's forward. I just didn't want to hit my head on the desk. Forward, backwards, right, left, twist, twist. And then you can move your hip through some basic positions. Pull your knee up, twist your knee out, right? Kick your leg out one, just a few basic things. And you can say, that motion's yucky. Then the key to discovering that which you don't know yet, but you will in a second, is to say, when I do that yucky motion, ow, right? Straight leg raise. How is that showing up in your life? Because you're doing it and you probably don't know you're doing it. And then it starts to help people make sense of things. Because here's the thing, man, if you just tell people to do things, don't do that. They're like, well, why? I'm not going to not do that because I like to do that. That's how I watch TV, man. You're going to tell me not to. Okay. But if I show them, hey, you see how that leg raise is yucky? Yeah, I see how that leg raise is yucky. Does it make sense then for you at night when you're eating? What do you think about this? Right? You don't have to stop it, but like, look at the position. You draw it in stick figures for people. Stick figures make sense. The yucky leg raise. There it is. It's just an L. Okay, then you take that L, and no matter which way you rotate it, if you bend and you go forward, it's yucky leg raise. If you're sitting on your ottoman couch with an ottoman or a coffee table, right? I think it's ottoman. I don't know what you call it, right? Your legs in a straight leg raise, right? If you're doing a certain motion in the gym, maybe you're doing bent over rows, right? Like this. Well, that's a leg raise, with the one leg up, right? And so like most people don't think of things like that because they haven't been taught to kind of look at movement. I'm not even talking about a diagnosis at the moment. I'm just saying that's a yucky motion. Yeah. Right? And it shows up in your life probably somehow in a way that you don't know. So you've got to optimize things physically, man. You do that by figuring out what you know and tweaking things, right, temporarily. Then you can kind of morph motions, if you will, find motions that are yucky and say, how are those things showing up in life and make some changes there. Clears things up a lot. Remove variables. Now you've got more clarity. Then you've also got to not forget, and this goes back to the last question, and cut me off at any point, I'm getting excited about this, all right, is how do we figure out, the cause of this or that? We talked about structural causes of pain. You roll at the back, because it's upstream. You roll at the SI joint. You roll at the hip because it's a little downstream, and make sure none of those things are causing the problem. But the most upstream thing is the brain. Like, hold on a second, my brain, like that's not connected to my butt. Are you saying your brain is outside and in a different body than your butt cheek? No, it's in the same body. In fact, it's like CEO, right? And so if you're constantly, man, on YouTube looking for answers, or constantly on Google searching for things, or constantly just freaking out about this, right? And just fueling it with attention and doing what I call poking the angry bear. Poking the angry bear physically, lots of people poking their butt cheeks, sitting on things, they're rubbing it all the time. I get it. The first thing I want to do if something hurts. All right. We're like wired habitually just to do it. It's like a magnet. Can't keep your hand from doing it. Right. Physically, you continue to poke the angry bear, but then you mentally do it as well, because you're constantly focused on it. Like, okay, that didn't work. How's it feel now? And then you wake up and you just like predictively say to yourself, like, okay, I wonder how this is going to feel when I get out of bed. Oh, see, it's there. Right. And so you're constantly just like hitting the button, just like, if you go into Costco, where they have those little counters every time you walk in.
Yeah.
It's like, yeah, like I once had one lady like keep track of that, because she was just like, it was an interesting experiment and she was down for it. I said, just hit that counter every time you think about it or every time you poke it physically somehow. And she just like had to stop at like a few thousand, because she was just like, I'm done. I just my thumb got tired. Right. And so you want to optimize things physically, man, first, physically and mentally. Then you want to learn to self-assess, right? The idea of like, you can't manage what you don't measure. So how are you going to know if what you're doing is working? You've got to have some baseline. If you're trying to lose weight and you don't have some scale to either measure your food, whether you believe in it or not, or measure your weight or something, then what's going to happen is you're going to let the emotion take over. You're going to let your conscious mind and the thoughts you have, good or bad or indifferent, take over. You're going to look in the mirror and one day it's going to be sunny and you're like, yeah, I think I'm losing weight. And then on a rainy day, you're going to be like, it's not working. Right? And so you get emotional about it versus objective. You've got to objectify or quantify the pain experience. It could be anything. How far can you walk today? Well, that's my biggest pain for walking. How far can you walk? We've got all kinds of stuff to measure how far you can walk. How fast can you walk? Cadence. It doesn't matter. From this mailbox to that mailbox. You don't need anything to measure that. Right.
Yeah. So would you say
when
that
you do these?
Yeah. I mean, just sorry to interrupt you. Would you would you say that spending more time digging into, what's yummy and yucky, the triggers that are triggering the symptoms, like it's obvious we have the pain. Are you saying that the best strategy to take overall isn't to go right into stretching, right into like doing banded clams, but to actually just focus more energy on your environment, how you're treating your body, the movements that you're putting yourself through, and then like allowing that to be your like beacon of what direction you should take?
Yeah, that's the first step, man. You've got to optimize things.
Okay.
You've got to scale. Let's just say, okay, on this side, right, is, I don't know, a smiley face. On this side is a frown face. You want to get here, okay, but you're feeling yucky. All right. You could fatten up this dude, feed him some good stuff. All right. I mean, you could do more of that which feels good. You could do more. I call it healing by addition. The number one thing people want to know, right? What exercise do I do for this? We could start there, but also like an easier way, rather than trying to overcome this dude who's way heavier than you right now, you could just shrink him down, put him on a diet, and you might not have to do anything. Most people do one or two things, in my experience. But you can't out-exercise the bad diet. It makes sense for losing weight, but people don't get it when it comes to getting out of pain. They think the more I do, the better I'll get. No, the more you do, the more confused you'll be, and the more chaos will be involved in the experiment, which means you'll have no idea what's happening. The less you do, the more clarity you have. So are you going for more chaos or are you going for more clarity? I'm going for more clarity. Cool. So you could do 10 things, or you could do one thing. I'd rather do one. Great. Right? And so you first want to optimize things. I call it heal by subtraction. Subtract, do less. You get more clarity, you get more bang for your buck out of that, man. And then we learn too. It's not like you're just removing stuff. You're learning by removing and tweaking some things as well. Hey, when I move my body, it doesn't like this. So then what's the opposite of doesn't like this? Likes this. So then you can often find that discovering that which you don't like leads you to that which you will like. This is the idea behind lots of methods, right? McKenzie method, for example, McGill method. Do this, brace your abdominals, and then do that again. Oh, feels better. McKenzie method. Oh, when you sit, you see how when you do this, it hurts? And when you do this, it feels better? Nothing fancy, just opposites. If you turn the screw right and it gets more tight, then righty-tighty, lefty, loosey. Oh, and when you sit like this, it feels better. So guess what? You probably have a preference for moving your spine more into that direction, and it becomes an exercise called the press up. There's value in finding what is yucky, because by default, if you know what is black, you know what is white. If you know what is yucky, you can find what is yummy, and vice versa. Okay? But you always start with optimizing things first. That is like the number one thing I would say to do for anybody with this problem. Simplify things, do less, get clarity. As you remove, subtract variables, right away you get more clarity. And then you can just start to optimize that which is yucky. Optimize your healing environment to begin with. And then we can add as much or as little as we need, which usually isn't much.
Yeah, it sounds like, because that's when you're at that point when and I'm on that same belief. It's like we have so much things that we can control on our daily life, our habits, both conscious, subconscious, like routines, all the things that we do that we don't realize that we do, that if you just spent more time, what you're saying, put that yucky guy on a diet, make him less fat, you're going to tip the scale. And oftentimes that will lead. And from what it sounds like, it's like once you've gotten to that point, let's say a month goes by and you're maxed out and you're healing, then it's like, okay, like you can try to stretch it. If it makes it worse, obviously that's a yucky situation. Or if you strengthen it and you notice that it makes it feel good at that point where you've optimized everything, now you can, if you want to attempt to go do some lunges or squatting, and then if it flares up, you know that maybe strengthening wasn't what you should be doing.
Yeah. Okay, good. You're getting into a good topic.
Yeah.
Okay. So here's the way I would challenge you to think of it. Out there in the world, we put stretching and strengthening because that's just what most people understand. It's not anybody's fault. It's just that's what we understand. That's even what providers use. We're going to stretch it. We're going to strengthen it. I'm not sure I really buy into that verbiage. Just by changing, like if you change the way you look at something, then what you look at changes. Okay? So instead of saying stretching, I say lengthening. Instead of saying strengthening, I say shortening. What you just said, okay, about, hey man, there's only maybe a few options. You could rest, or maybe you could stretch your strengthening. I would say that discounts the systems theory. Meaning, if we were just all individual parts, an arm, my daughter, she has these dolls, play with Tickle Monster and then play with Elfie and dolls, okay, and babies or whatever, right? So if you were to rip the arm out, you know what I mean, you could take these dolls apart. You know what I mean, they're all these kind of, I don't know, it's all connected, obviously, you know, and that's how you get a doll. But at the end of the day, like they're kind of these individual things. And obviously there's no brain tying them together. I'm the brain when I'm playing dolls, right? And so, you know, if we were Mr. Potato Head or Mrs. Potato Head, right? Like it would make sense that, okay, if it hurts in the butt, then let's just treat the butt. That's where we've got to focus. And that's where everybody does focus. They focus on the area that hurts. You get shots there. You get MRIs there to try to figure out what's going on. You get stretches there. You get strengthening there. You get different stuff there. You get massage there. You put the tennis ball there. We have just been conditioned to look at that which doesn't work and focus only on that area. If you go to school right now and like my daughter, she was to bring home a little test. She's only 5. Hopefully she ain't got no tests right now. Right? But she does have a kindergarten test coming up. All right. But I'm curious to see what they do, right? So it's like, okay, so you've got these 10 questions. And what do they highlight on the test? All the things you get right or all the things you get wrong? All the things you get wrong. Right? That's what you get it back. You remember those big red X's. I remember I got this D on this math test. You know what I mean? It's like Miss Panetta. Miss Panetta, are you still out there? Right? B, right? All I remember these big red X's. But what if they in green, they checked all the things you did get right? And the reason this matters is because we have this system. This is 100% of us. If I was to draw a little gingerbread man, we've got 100%. Everything's connected. Your butt and or your leg that hurts right now is not in a different body than everything else. It's a system, 100% whole. But everybody wants to focus on like the 10% or maybe the 15% that doesn't work to try to fix their problem. That would be like me saying to my daughter, hey, we've got all this property, and you see over there, there's like a fire. I only want you to play and run around circles around that fire, and you can't play anywhere else. Doesn't make any sense. You would never do that. They would get burnt. They would get hurt. That's the highest risk area that you could be getting treatment in, regardless of what you want to call it. So my recommendation, when they do start to heal by addition and start moving their body, is simply focus on what you can do, not what you can't do. Everybody is focused on what they can't do, mentally and physically. Oh, when will I get back to running? Maybe you still can run, but you have to change your cadence, or you can only run uphill. Or you've got to run for a bit and then side shuffle. Right? And so there's always something you can do. But when people use treatment, they only think like, oh, Piriformis Syndrome. So like, I've got to treat the butt, the right butt cheek, because that's what hurts. Why not treat your left butt cheek? Well, that doesn't make any sense. Well, what do you mean? Are you saying your left butt cheek is not connected to your right butt cheek and not in the same system? It's in a different land? It's in a different universe? No. Why not move your trunk? Why are you avoiding or resting your body because your 10% of your body doesn't work? That would be like saying, hey, man, I've got a business with 100 employees and one person didn't show up today. Shut it down.
That makes sense.
You should be doing some push-ups, some pull-ups, I don't even care. You should be, your left leg should be jacked. Just because your right one doesn't work doesn't mean you can't do anything with it. Like, doesn't mean that you have to, shut everything down or stop. Right. And so I think that's one thing that I would want to kind of like dispel about the way we approach this is everybody's focused on the area of the injury that hurts, but you have more opportunity. 90% of the property, if you will, is not impacted. And so if you just rest and shut it down, you're reinforcing that which you are like avoiding is bad. You're reinforcing the pain-fear cycle, right? You're becoming deconditioned physically. And so it's like you're becoming deconditioned and depressed. I don't know if that's a good approach, right? And so it's like, if we're going to use the mind and movement as medicine, focus on what you can do while you optimize the environment, mentally and physically, and stay as active as you can. And whether we want to call it stretching or strengthening, I just think of it as lengthening or shortening, man. You can lengthen or shorten. And the only way to know is to test. And how do you test? You find something that doesn't work, you do it, and you retest it to see if there's a change. I don't believe in this. You gotta wait 6 months for this treatment to work thing. No, I don't do that. I want to see like in 10 seconds.
Yeah.
If we're going a motion-based approach.
Yeah. I think that's a really cool perspective. Just like, I think that's what the medical model does. Like say, hey, okay, you're going to be here for 4 to 6 weeks. We're going to see where you come out at the other end of this. And maybe from a post-surgery rehab setting, that makes sense. Like, yeah, we have to rehab you back to whatever. But I like the way you approach it and the way you kind of talk about this. Like, look, like you can gather data, you can do things right now in your office, desk, at work, whatever, that gives you information, and information you can, because you're capable of doing that, make sense of your pain and then make better decisions by yourself. Like, you don't need to go, hey, I just twisted and it hurt. You don't need to go to a doctor or a PT and say, hey, I just twisted and it hurt. Should I keep doing it? You could probably make decisions based off of what the concepts that you're basically explaining. Like, let's just remove these things for now and see how the body responds. And then we make more educated decisions after that. So yeah, I love that, man. I think that concept is awesome. And that's just how that makes sense to me. It makes sense to me. So, So we're at the hour mark. I wanted to get, you've answered pretty much all these questions that I really kind of had written down. I appreciate all the information. It's so many golden nuggets just on this topic. I know I could sit here and talk all day about this stuff because this is, I nerd out over it. So I understand, but just to kind of keep people from, getting too antsy, I'm going to pick two rapid fire questions that I got in from, my audience. And then I've got a segment called, it's a bonus question segment called If I Could Go Back. Okay. So we're going to keep this brief.
Cool.
Two questions. One, and this is kind of, these obviously back issues, surgeries, fusions, whatever you've had done, context is very, very important. So I'm going to try to give you as much context as possible, but at the end of the day, high level kind of ideas. If you've been fused, let's say you have a ruptured disc, let's say you're not currently having any kind of really bad throbbing pain, but you have a history of a ruptured disc, or you have a history of degenerative discs, or some kind of what you've been labeled by somebody as having damage, or you've been operated on. So your mechanics have changed, your spine has changed in some way, and you are in pain. Do you think, or what would you say to somebody who is 8-10 years into this, let's just say post-fusion, right? Because everyone's back situation is very specific and very different. So let's say post-fusion, you've had I ruptured my L5S1 disc. That's my story. I was supposed to have a fusion. I opted out of it, and I'm just living with a ruptured disc according to them. So you talk to me 10 years later in chronic pain. Would you say to that person who has been fused, I mean, you've been fused, like, this is it. Like, I mean, you can try to gain as much control as possible, or not, or really it's just like, I mean, this is kind of like the cards you've been dealt. So really you're in damage control mode. Or do you say, no, like, yeah, you've been fused. You never had your whatever fixed. You can live a totally pain-free life. Or are there always exceptions?
Yeah.
Does that make sense?
It's a good Yeah, I think so. I think, again, it's a little bit, I don't know, maybe it's a little like specific to, the type of fusion, or, whatever the history looks like. But I would just say at the end of the day, man, like, we all have like a choice, right? And so absolutely, if you have a fusion, right, like, there are chances that you'll have some type of adjacent segment failure maybe, and you'll need another fusion. I mean, the stats aren't great on the success rate of fusions, right? But like, at the end of the day, if you've made that decision, you can't change the decision. So you've got guilt, which lives in the past. You've got worry, which is going to live in the future. And I'd say, hey, man, how can you control the controllables? At the end of the day, the reason I'm big about teaching people how to resolve their own problems and coaching them, if you will, is because, like, let's just say you, the person in pain, right? Or the listener, right? You're the only one who knows what you're truly experiencing. Lots of people rely on this external thing, right? This diagnosis, or like what somebody else told them, or this person to feel what's out of place or whatever. But like, how empowering is that? Or how disempowering is that? And I can say this, man, as somebody, I used to teach manual therapy, right? At some really good places. And so I would crack necks and backs and this and that, right? And it works really well for the moment, right? A lot of these different things, chiropractic, osteopathic, again, there's different approaches within it. Even PTs like myself, right? We all have manual treatments.
Right.
But at the end of the day, like, people are generally or inherently bad at fixing themselves. And it's not their fault, right? It's not your fault. It's just that we don't give people the knowledge and the understanding of what they need to do to solve the problem. And so I go back to, how can we control the controllables? You're in control of your movement and your mind. So your reality is really just a reflection of sort of inner world. You could say your outer world is a reflection of inner world, right? And so it's this idea of like, here you are, right? Post-fusion with back pain after, say, 10 years, right? And there's this mirror, right? Reflecting back, I've got a bad back, I've had a fusion. And guess what? The mirror don't lie. You ever try to look in the mirror? You can say you have a six-pack, but if you don't have a six-pack, it doesn't show you a six-pack, right?
Yeah.
And so at the end of the day, everyone wants to try to change the mirror. Call this mirror principle, all right? See, that didn't work, so like, I'll try a new diet if you're losing weight, or I'll try a different treatment because that didn't work, because that didn't work, because that didn't work. rather than changing the person in front of the mirror. Because what happens, man, is that fusion, all of that which has been told to that person. You've got a bad back. When you bend over, your jelly's going out the back of the donut, and this and that, right? Like, it just becomes a part of people's identity at some point.
Right.
And so if you're really going to change, you want to change who you are. You want to control what you can control, your mind and your body, the way you move, the way you think, the knowledge. Here's the thing. A lot of where that question comes from. I've had this pain for 10 years. Do you think that I can get back to whatever I want to get back to? Or what do you think life will look like? That's called like fear, worry, right? Again, it lives in the future. Well, fear is the result of what? Doubt, ignorance, not knowing. Not because of your fault, probably because of medical community, people like me's fault. That's why we need to create more content, right? And so if you have this unknowing, because you haven't been educated about what pain is and how you can, and how a lot of these things, by the way, can get better, can heal, ruptured discs, stuff like that, even fusions. I mean, there are people who go on, right? Some people take the route like, I have fusion, doctor told me I should never do X, Y, and Z. And they box themselves in. They quit their job, they change their profession, right? They do this, they don't play golf again. And then you've got other people like Tiger Woods who like goes on to win stuff again.
Yep.
And so what's the difference? Human with a brain and a body, fusion, one limits, the other doesn't. Now, I'm sure there's maybe some limitations in there, maybe, right? But at the end of the day, like drastically different kind of quality of life. And so what is the antidote to this fear and this doubt or whatever? It's knowing and understanding what you have in your power and what you have in control to leverage the resources you've been given, brain and body, right? To change your thought patterns and then not have it be someone who's defined as, I've got a bad back. I can't do X, Y, and Z. Right? And so it's this weird self-fulfilling prophecy and a little bit of self-sabotage that happens for people who become in pain, right? Or who get stuck in pain. It's like, yep, I have bad back. And then because of that, it like naturally highlights all the reasons why you have bad back. See, I bent, I felt something. Yep, I have a bad back. Yep, I have a bad back. I move less I move. Yep, see, and before you know it, you've absolutely got a bad back, man. You've got a bad back because you've been told you have a bad back so much that it's just a part of the way you identify with things.
Yeah.
So how can we shift the identity? How can we give people the knowledge, tools, and understanding to understand their mind is a very powerful thing and they can choose consciously what they want to plant in subconscious?
Yep.
Right? Mind is like garden. How can you weed all these things, all this dogma, and maybe say, hey, maybe that's not true? Because there are lots of people out there who've proven that they can have one leg or bad back or one arm and still do great things.
Yeah.
And so I just say, like, that is something where I think a lot of people just get in their own way, not on purpose, obviously, not intentionally, but control the controllables. You've got your mind, you've got your body, you've got the understanding of pain, which goes deep, right? And you know it goes deep, right? So there's education that can be had there.
Right.
And then there are ways that you can move your body, right, to build up the resiliency, build up the strength within the system, which is, I think, a lot of what you talk about, right? And that has a mind-body effect too. Makes you feel more safe.
Yep.
Makes you feel more confident. Are those physical things? Maybe, but they're more here. And then as a result, you can move more. And the more you move, the more confident you feel. The more confident you feel, the more you move. And before you know it, right, you don't associate movement pain.
Yeah.
You've got to break the movement pain relationship. And you
That's
can
good.
do that mentally and physically.
Yeah. I like the idea of the garden. You said it very briefly, but if I wasn't doing what I do, I'd be like I would teach people how to grow food. Like that's like my little other thing that I do. So cool. I grew up gardening. My parents had big gardens. So growing food and like that homestead type of life, having chickens, all that stuff is like awesome to me. But the garden concept, like, you know, you have this thing that you're trying to grow. You want to, you know, water and feed this one thing that you really want to produce fruit. But if you have all these weeds and all these other things around it, it's going to harm it. It's not going to it's not going to bear the fruit that you want. So I love that little quick analogy that you said. That really spoke to me. Last question.
Yep.
I got, this is on the topic of like back spasms, right? Muscle tightness. And I want to give this question a little context with, let's say you have a history of chronic back pain. Okay. And you do not have the chronic pain that you used to have. Maybe you had sciatica, or maybe you had pseudo sciatica, whatever you had that was really bad. Now all that's gone. You're not in chronic pain anymore, but you every once in a while, maybe once or twice a week, you wake up and your right QL's tight. And you go to sleep and you wake up and your left butt cheek's tight.
Yep.
And you go to sleep, and then you kind of get into this, like, every time you go through a workout or maybe a walk or something longer, your body responds with a random tightness, cramp, achiness. How would you explain that to somebody with where they're at, knowing their history?
Yeah, exactly. It would come into knowing the history and being able to put all the pieces together, right? But like, it could be caused by one of two things. It could be a structural thing, right? You're doing something about that activity when you're working out or when you're gardening or whatever could be optimized, right? Such that maybe you're not bending a certain way. Not that it's good or bad, but your body is sensitive to it for some reason, right? Or maybe, hey, like when you get the groceries out of the car, like, I don't know, you've got a car with a bunch of junk in the back, and so you always shove your groceries back there and you pick them up, and you could keep the load maybe closer to the body. We don't maybe have a perfect answer to that, but like, that would be a structural explanation, right? It's like, hey, how could we analyze what's happening? How could we kind of identify and or pinpoint that within what you're doing in life, whatever it may be, right, is part of potentially the issue? And then how can we manipulate it to learn more about it? I'm very much a scientist.
Yeah.
Like, even if I don't know the answer, I'm just going to tweak that thing or change that thing, right? And look at the variables involved with that thing, okay? And so it goes to sleep, right? Like, is it nighttime routine? If you're having trouble falling asleep, then look like an hour before. What are you doing? If you're waking up in pain, it's probably not nighttime routine, but it's either the surface, which you can control very easily, and or it's probably position, right? And so you can start to segment out these different variables. And so I'd say there's probably something you're doing physically there, which might be obvious to people, or structurally that's aggravating a problem. Now, I will say that, like, when you hear the idea of, I call it roller coaster of back pain. Back goes out, can't stand up straight, I'm a little crooked, whatever, I'm hobbling around for a little bit, and then it goes away, right? And I'm good. There's an episode where I'm pain-free, episodic back pain, all right? Then, oops, threw back out, I'm in trouble again, leg pain, back pain, butt pain, whatever, and then gets better, right? This is pretty consistent if we look at the structural causes with more of a disc-related, we call it discogenic-driven pain, right? So when somebody says, like, hey, I throw my back out, right? It's usually maybe somebody who's younger, usually some type of, I don't know, lifting, bending, twisting, something that happened there, and it's not usually in question, more of a structurally originating source of symptoms, probably disc-related, but it could be lots of things. Sometimes people describe things with SI joint stuff that's sudden and kind of funky. So that's where we'd have to go deeper into the history. All right.
Okay.
The other thing it could be too, aside from it being structural and then needing to kind of do some detective work there, right, would be it could be a learned response, right? Now, I know this is funky and it might not fit 100% because, hey, like, I could do that activity last week, Charlie, but now you're telling me this week all of a sudden I can't. So that doesn't really make a whole lot of sense, but you do see a lot of times where people avoid things. I was doing gym. I was lifting weights in the gym, hurt myself. And then I avoided it for 6 months, let my back calm down. And then I go to the gym and I hurt myself. Avoided it for a few months or a few weeks, went back to it, hurt myself, right? And so you have to ask yourself, is that structural or is it something that's learned? Right? And it could be learned in the sense that, well, you can learn pain just like you can learn to play a guitar or learn to plant garden and live a homestead chicken style life, or whatever, chicken lifestyle. And so it could be, right, that you've associated, and I've seen conditioned or learned responses to everything. It could be you've associated lifting weights or gardening with pain. And you do that enough. Every time I garden, pain. Every time I garden, pain. Yep. Oh, let's see how gardening goes today. Oh, my back doesn't hurt right now. Let's see how I wake up and feel tomorrow. Well, of course. I mean, that's like, if your kid's going to take a test, you say, hey, you're going to fail the test. You know that, right? You're going to fail. You're going to fail. Tell yourself you're going to fail. I mean, the chance that then that thought is going to evoke them into an action which is going to allow them to pass, study hard and whatever, probably not very good. Maybe, but they're probably going to take actions consistent with, yep, I have a belief I'm going to fail, so why even try? Right? And so at the end of the day, right, you can condition that response. I've seen learned responses to running, lifting weights, fishing, playing tennis, I don't know, some funky stuff out there, but all kinds of things, sitting, driving, bending, you know. And so are those spasms something that's of structural origin and something about the way you're doing things for whatever reason is not optimal and your body's letting you know it's not safe, so it responds? Or is it something you've had this problem within the context of, hey, when I do this, my back spasms, right? Like enough to where you could just be associating that thing with pain and you get a pain response. It's real pain, but it's more of a sort of physical manifestation of like a psychological learned habit or pattern.
Right. So would you say that in order to, I mean, let's just say it's playing golf, right? If every time you go out and play golf, you always experience pain, would your approach be more like, I want you to go out there, or just stay at home and just putt around your living room?
Good question. It would depend on a few factors: severity, irritability, reactivity. And then like stability of the condition. All right. So PTA school probably learns now. I know you say your dad's a PTA, but in PT school, we learn something called SINS: severity, irritability, nature of symptoms, and stability. What this means for the viewer. Okay. Severity of symptoms. How bad does it hurt? Okay. Irritability. How reactive is it? Meaning, I do one little motion, right? And then I'm out for weeks. That's a highly reactive. That's like a fire where you just look at it and it starts to freak out on you, which I have never had happen before, but you know, right? Like the idea. Okay. Nature is like, we'll describe the type of symptoms, right? Burning, tingling, shooting, zapping, achy, whatever, right? And then stability is like, are things generally getting better, same, or worse, right? And so the big things would be the first two. If you're telling me things are really, really yucky, man. Okay, I'm going to say how yucky, right? And let's just say, I don't know, if 0 to 100, 0 to 10 scale is too small for me. It's hard to detect change on a small scale, right? So like 0 to 100. So is it low, medium, high, yucky? When I golf, man, it's like super yucky, high yucky. Okay, 70, 80, 90, 80. That's pretty bad, dude. That's pretty bad. All right. Weather driven from your mind and or from your body, that's going to freak things out. Either it's going to aggravate something, probably structurally, and or it's going to like set off the bells and whistles mentally. All right. Let me get to this. Irritability. Again, hey man, when you go golf, how long does it take for things to calm down? Does it take 5 minutes? I swing, it hurts a little bit, and then I'm good. I just walk it off. Or, hey man, I'm laid up in bed for a week. So I think you need to look at those variables. And what I use to help people decide, should you do something or should you not? This is the decision-making framework I would use, right? Is like red light, yellow light, green light. Red light, let's just say you want to go golfing. Red light, meaning you can't do it. You should stop that and maybe rest or focus on what you can do. Relative rest, right? Is symptoms are high, super yucky, man. I don't know, 6, 7, 8, 9, like really, if you want to go on the 0 to 10, because most people know that, right? Like pretty yucky. And man, afterwards, I feel like I need to take some meds. I feel like I can't sleep well because it's lasting. It's pretty irritable, right? Like I'm hobbling on the way home and yeah, man, I'm just like, I can't get it off my mind. Yeah, I don't want to do that. It's too threatening. Let's just call it threatening. Okay. Yellow light. When you go golf, do you feel some symptoms? Yeah, you feel some symptoms, but symptoms are mild to low moderate. Maybe a 2, a 3, a 4, no higher than that probably, right? And either the more you swing, the better it gets, or it just stays the same. And afterwards, it resolves rather quickly and you don't need meds. You're not thinking about it later. You can sleep fine. Like you're not all like laid up in bed, right? And all flared up. Then I'm going to say, hey, man, I think that's probably a fair place to be. Now, we might be able to change, like you could do it, but we might start to, and I'd feel safe and use that as actually like an opportunity to learn more. I would be saying, hey, man, how can we like tweak maybe your stance a little bit? Or how can we play with a couple of these different variables to learn more about that which within golf? Because here's the thing. I had a guy I chatted with recently. Surfing sucks. I said, no, surfing doesn't suck. Surfing, as you know, it sucks. But can you paddle? Can you lay on the board on your belly? Yep, no problem. Can you paddle? Yeah, I can paddle. Okay, can you do this? Can you do this? What you can do is you see surfing or you see golf as this castle of different components, which you call that activity. But if you pull out all the individual Legos, which build that thing or make up that thing, all the individual components, you will see that there are many things within it. So it doesn't hurt when you play golf. Kind of does. But what I'm saying is that within golf, it's just the backswing. It's not this, it's not that. It's only when you use the driver. It's not when you use that. It's only when you're trying to hit for this. And so then golf becomes not something you just can't do, but it becomes an element within golf that we just need to tweak and learn more about. And then we can dive more into that. And so it kind of goes again to focusing on what you can do versus can't. People just want to say, golfing's terrible. I can't go to the gym. What do you mean? Your arms don't work? Right? You can go to the gym. You just can't maybe work that leg. Or you can't do core exercise or whatever because it hurts, or whatever, pull-ups. Because when I hang, it hurts. Okay, great. But within it, let's try to isolate the variable. This activity, golf, surfing, running, or whatever, something probably within that, only probably one or two little things is really the problem. And so how can we tease that out and isolate it to then focus on maybe tweaking or changing it and learn about it? And then that tells us what we should do and maybe what we need to temporarily tweak or remove. And that's that, man. So red light, yellow light, green light. Red lights, don't do it. Yellow light, opportunity to learn, right? And then green light, you ain't got no pain or problem. You probably wouldn't be chatting with any of us here or looking for a solution. Just do it.
Yeah, I like that. Well said. Well said. Yeah, that's awesome. So what I typically do, or what I start doing really, is create a segment at the end, just a one question, off topic, more personal. I call this "If I Could Go Back." Okay. So the question is, what do you wish you spent more time doing 5 years ago? What do you wish you spent more time doing 5 years ago? Now you have a 5-year-old, so you're probably going to say, I probably wish I slept more. What would you say 5 years ago?
5 years, and this could be anything, right?
Anything.
Here's the thing. Like, I don't really regret anything. In fact, like every opportunity or like stinky time is like probably a good opportunity to learn something else and grow from it. So I'm very like growth oriented, right?
Yeah. I like
I'm not going to say like, hey, like what was the question? What would I spend more time doing?
What do you wish you spent more time doing 5 years ago?
This is a tough one. Playing with chickens and gardening. No, I don't have a place. Actually, I do have a place now to do it. But 5 years ago, how old was I 5 years ago? 28. I started my business. I was 6. I guess it's maybe not the greatest answer, but like I probably wish that like I would have maybe like helped my wife more with like raising my daughter at that time.
Yeah, that's good. That's real.
Right? At that time, I was like renovating a house. So I was PT by day. I wasn't Tickle Monster at night, but then I would go in the middle of the night and I would renovate a house. So I live in a duplex. We have a couple different properties. So like we were just going crazy at that time. Plus I started my business. My daughter was born and I was renovating a house. So all through the night or late in the night, I'd have like marks from like respirator or whatever. Like I'd go paint, look, and some other stuff there. And I'd renovate house. And then I'd build business, right? Like shoot content for people and just like try to help as many people out as possible. So that was obviously a big learning curve to that. But for me, man, it's just like 5 years ago and even now, obviously the focus has shifted, but it's like really, gosh, like I just wish I could be more present, not only 5 years ago, but even more now. Like that's a big thing for me that I'm trying to focus on. As much as it's nothing against listeners, as much as it's great to help other people, like if you're not helping yourself at the end of the day, like this is actually a nugget for people listening. You've got to spend some time to like tune into your internal state, like check in with yourself, make sure that you're healthy, make sure you're eating well, make sure like you're just not sacrificing yourself or whatever. Right. And for me, it was I wanted so badly to help as many people as possible. Right. And to kind of like build something out there that I just worked really, really hard, man. And I still do. Right. But I'm getting to the point where I can slow a bit. And so spend more time with daughter. I can't say I've been as I played my own role, but I wish I would have played a different role back then. And so it's still something even to this day. I was just talking about the other day with my wife. It's like I want to be more present with Cameron. She's really cool, man. Super cool girl. A lot like me, which means she's wild, and so she needs a lot of attention and energy. So.
Oh yeah. That's awesome, man. I really appreciate that transparency. That's what I was hoping to get. And that's what I try to get people is like, it's great to talk about what we do, but this is not life. Life, it has a lot more to it than just pain and helping people. It's real and raw. So I really appreciate your honesty, man.
No problem.
And hey, I appreciate your time today. I appreciate you answering all the questions that we had. Would definitely love to, pull out some other topic and have you back on the show. Because I know you're just a wealth of knowledge, and I just would love to just chat all day. So thanks for coming
I
on
have
the
so
show.
much I could talk about.
Yeah, dude, you're a smart guy. You got a lot of experience. You got a lot of stuff going on. So I just appreciate you coming on, man, taking the time.
No, I appreciate you inviting me, man. It was great to have everybody, and hopefully some people can pull some nuggets out of this. So.
Yeah, yeah. Oh, real quick. Where can people get more information about you?
Yeah, so probably best thing, man, and a lot of things kind of stem from this is just head over to my YouTube channel. That's one place. So it's Dr. Charlie Johnson. I'm pretty sure that's it. You can always put a link to below this, right?
I will definitely.
And then as far, man, even about the conversation today, piriformis, sciatica, brain, body, what's the cause, what's going on? Like, I really want people at the end of the day to move beyond problems into solutions. So much time and energy is spent on doctor hopping, getting x-ray, MRI, this, that. Most people don't even get to talk to people for 5 seconds, And so it's like, I've been really fortunate to chat with thousands of people, right, as it relates to these problems, work with spine surgeons, hip surgeons, work with conservative care providers, and kind of put like all of it together to teach people how they can use like their story, their history. They can use movement exam, right? They can use what feels good, what doesn't feel good, and all of that stuff, man. And this stuff should be available to everybody. You should not have to pay to see a specialist and wait a month to like, most people will not need images. Most people will not need things like that. I'm not saying there's not value behind them. Cancer, tumor, fractures, infections, whatever. But at the end of the day, let's move past that diagnostic kind of like, I don't know, stickiness, right? And let's move into solutions as far as using what we know works for a lot of people, man, brain and body. That's all cool. Right. And so I would just recommend that, if you check out my YouTube channel, there's a ton of stuff there, as you know. Also, check out my diagnostic guide. I put a ton of time and effort into it. I constantly update it too. Helps you kind of really get past, again, that diagnostic question and just move into like, okay, now what can I do about it, right? And it's all available, everything I've learned. My entire like diagnostic algorithm that we talked about today, like in a tiny little section, right, is all there and expanded. So if you could put a link maybe below to that, it's www.drcharliejohnsonpt.com/DIY guide.
DIY guide. Okay. We'll definitely, I'll get all that information from you. We'll make sure it's all in there, right?
Yeah, or maybe a card or something. But if this is not on YouTube and it's podcast, maybe below or something.
Okay, cool, man. Well, awesome, dude. I appreciate it. Thanks for coming on.
No problem, man.
It's been a wealth of knowledge. Really appreciate it, dude.
No problem. Have a good one, man. Thanks, buddy.
All right.